Quinn Bina. I am kinesiology health ed faculty, and myself, Darlene Del Carmen, Jessica Weiler, Jamie Adams, and Diane Reed. We are part of the Health and Wellness Career and Academic Pathway, and we brought a panel of professionals here to speak with you so you can learn a little bit from them or about the career opportunities that are within health and wellness. And so we have Dr. Ken Adams from CSUMB, Monterey Bay. We have Nick Calvin from the Department of Public Health, San Benito County. We have Tony Tognetti from Apex Fitness as physical therapist. And we have Ian to RN, Donnie Lynn, who also went through our program here. So we're going to go ahead and let each of them speak, and then when they're done, we'll open it up for questions. So if you want to jot a question down and ask them when they're done while it's fresh, we'll go ahead and do that, okay? So without further ado, I guess I should say thank you to everybody that helped coordinate this, Grant and your team, Darlene and Ryan Shook that helped with some of the other pieces of this event. So make sure you're sticking around for pizza after. All right, Dr. Adams, go ahead.
I'm excited to be here today. I actually have had students from here that have graduated and went on to do great things in our program. Eric Lopez is one, and also I've never been on this campus before, and I always enjoy that. It's very beautiful. So I am a professor. I'm an exercise physiologist. I'm a professor and the department chair of the kinesiology department at Cal State Monterey Bay. I came to Monterey Bay to start the kinesiology program there from the University of Louisville in Louisville, Kentucky. My background, I have my doctorate's in really strength physiology, exercise physiology with a minor in gerontology. My master's degree was in exercise physiology and cardiac rehabilitation, and my undergraduate degree was in zoology with a business management minor. So I may get to how that all transpired to get me where I'm at. Cal State Monterey Bay is a great opportunity for you guys. We have a wonderful program there with very enthusiastic professors that do wonderful things in the classroom and in the community and in their research labs. Our program is a Bachelor of Science in Kinesiology with 2 concentrations, one in exercise science and one in wellness. So if you come in with your associate transfer degree from Gavilan to Monterey Bay, we guarantee you can get out in 2 years. You actually can get out in a year and a half very easily if you want to, because we offer robust winter and summer sessions. The curriculum there, if you came in, you would probably have your anatomy and physiology, but we have a full-blown anatomy and physiology lab with the state-of-the-art anatomage virtual cadavers like are used at Stanford Medical School, et cetera. So you can also take anatomy and physiology there. And we then your core choices would be, there's a common core that includes classes like exercise physiology, like ethics and physical activity and health. We have a service learning requirement. Our students do close to 3,000 hours of service in the community related to trying to improve the quality of life of people in the Tri-Counties. Students actually really love that course. And we also have internship opportunities in over 50 different companies, ranging from physical therapy to occupational therapy to the local hospitals to applied strength and conditioning opportunities. So students have some robust choices for applied learning at internships. And if you need jobs in the peninsula, the physical therapists in the area actually typically just call me when they need new aides, because what happens is our students are working for them. They go on to get their doctorate in physical therapy, and instead of putting an ad out, they just call up and say, send us a couple more wonderful students. And so there's lots of opportunities. Also, right off our campus, the Montage Wellness, the hospital, the big hospital in the area, has a fitness facility there, and in Salinas that hires a number of our students to work as either front desk or if they're certified as personal trainers in their facility. So there's a variety of opportunities there in the community. Some other things about our program that are unique, and again, I left some information with Nikki. There's a QR code you can scan on your phone to look at the curriculum and all that stuff. But some of the unique things, again, we have very highly qualified professors who we brought in, just like myself. I'm not from California. Came in from other universities where my prior university was a research-intensive university, and my job really was more about bringing in research money and publishing than it was about teaching, although I did teach graduate students. Now, the faculty at CSUMB all love to teach, and we all still love to do research. So we came here because we wanted to impact undergraduate students. But the faculty all brought their research agendas and their research expertise with them. And so students in our program have the opportunity to do research ranging from nutritional science to applied strength and conditioning, biomechanics, sport and health psychology. And you can work with professors, and students actually publish in international journals with us and present research at national and international conferences, and we have mechanisms to fund those students. We just had a number of students from this area actually go to Southern Cal and present at the American College of Sports Medicine conference. My point about that is we offer you tangible opportunities that mean something to PT schools, to employers, beyond just the degree. Our capstone, we urge students to sit for internationally recognized certification exams from the American College of Sports Medicine or the National Strength and Conditioning Association. Why does that matter? Because these credentials will get you a job. You want to work while you're going to school at Chomp next door to us and you're certified by the American College of Sports Medicine, they'll hire you as a trainer. So we want you to have tangible skills. We have a lot of nice students. That really doesn't say much to a grad school or to an employer. We want nice personal students that also have tangible items on their resume like internships, service learning, publications, presentations that give them a step above their competition, because that's what it is at the end of the day. So we do a variety of, I'm keeping track so I don't talk too long. We do a variety of things like that, and our program really tries to give you a leg up. We also have a very dynamic exercises medicine program. We're a gold medal campus. There's about 80 of those gold medal campuses around the globe. It's affiliated with the American College of Sports Medicine and promotes activity as a vital sign in the campus community. For example, if you went to our health center, no matter when you go, they will ask you about your physical activity. Our students can be trained to be peer mentors to help other students or faculty across campus live a better lifestyle, both in nutrition, mental, and physical health. So the Exercise Medicine on Campus program gives students wonderful opportunities, and we also publish research from that program. We also do a lot in the community with the Power Over Parkinson's program. One of our faculty members founded through a nonprofit corporation a program that works specifically with Parkinson's patients in the peninsula. They have their own clinic, and our students go down and work on exercise and rehabilitation, or exercise and health promotion with Parkinson's patients. And it's exceptionally rewarding, again, to be doing that work in the community. Our students really like that. I mentioned our internship program as well, and that's something that really helps our students do better. Our opportunities range as far as careers, everything from fitness instructors and personal trainers. We do a lot of work in corporate fitness and worksite health promotion up in the Bay Area, strength and conditioning coaching, exercise technicians, fitness club administration, worksite health promotion, kind of the gamut of careers that are possible. And we have actually a lot of prosthetics companies that have been contacting us, and they really like our students to go into the cells because of their knowledge of anatomy and physiology and their interaction with medical professionals. And so that's kind of a unique opportunity as well. When I was coming up here, I was looking at a couple things that you guys, that Nikki had mentioned to me that actually I thought were kind of cool, that So professional organizations I'm involved with, I urge you, I'm a fellow of the American College of Sports Medicine. That's the leading organization in the world in exercise and sports medicine. And there's a lot of opportunities, and a student can join for $10 and get tons of benefits. You can just go to acsm.org. I'm also heavily involved in the National Strength and Conditioning Association, which is the leading organization in the world in applied strength and conditioning. I hold a Certified Strength and Conditioning Specialist certification, but also I'm an editor of their scientific journal, the Journal of Strength and Conditioning Research. I'm involved in a lot of the scientific information that these organizations put out. And we use textbooks from these, when I say from these organizations, it's from scientists like myself that are involved, that author different position stands and textbooks, et cetera, with the group. So I urge you to look into those groups. We're also involved with the National Athletic Trainers Association and our I always get this wrong, the North American Society or no, that's not right, but I'm forgetting the acronym, but the Health and Sports Psychology Group, they also have a professional organization that our faculty members in sports psychology are heavily involved with. You know, how I spend my time, it was interesting on a daily basis. I have to deal with a lot of administrative crap as department chair, the bad part of a job, but other than that, I still teach and I do a lot of research, so I interact with students a lot. I prepare to teach, I'm in the lab, and I do a lot of research, so I work in we have state-of-the-art laboratories, so I work in there, and then I spend a lot of time writing manuscripts for publication. So a lot of times I'm just in kind of a hole, so to speak, in a cave writing, but I love to do that, and it's really rewarding part of research is a rewarding part of my job. I also really enjoy working with students. That's why I chose to move out of the research intensive university that I was previously at. It's interesting on here, like, you know, how I got here, really, I really am a professor and doing what I do. All my research surrounds strength training, and I really say, getting back to my youth and my fascination with lifting weights. I grew up in a farming environment. I worked in the fields. I worked in where I had to carry things, and that led me into lifting weights. And one day there's this new field really starting to develop called exercise physiology, and I was fortunate to run into the right person at the right time on a college campus and found out about this field, and one thing led to another. I thought I would become a strength coach, but when I graduated with my master's degree, it was not that great of a time to stay in school, and I had the opportunity to get assistantship, so I didn't pay for my graduate school. I went to work for the universities doing research, and so I was able to stay and keep doing that, and that's how I wound up ultimately becoming a professor. Key lesson I learned early in my career, first of all, working on farms taught me a work ethic, and that was the number one lesson. Work ethic, and my parents taught me to be honest and have integrity, and that one of those things went a long way. Got a lot of opportunity just out of being willing to work, being honest, and knowing that people could trust you. And the key lesson I learned, and I would say to you guys, is to stay curious. Staying curious keeps your enthusiasm, keeps you passionate about what you do. And the only other thing I'll say, and then I'll shut up and see, is that preparing for the world of work, you guys, no matter how good you are at science, and I think our physical therapist here would say this, you have to be able to interact with customers. And I just met with 40 GMs of health, fitness, medical establishments around the country. They told me, they gave me a lecture at the end, said, what you do scientifically is great. Your students need to be able to communicate. They need to be able to market themselves. They need to understand basic finances, and they need to be able to interact with our clients, because if they can't, no matter how much they know, it doesn't matter, because you're not going to help the business out. And business, let's be real, business matters. You want a paycheck, and they want to be able to pay you, so they need people that can do that. So I'll stop there, and I apologize. I have a dog that has epilepsy. Everything's managed, but I'm pretty much have to stick to a pill regimen with the dog, so I am gonna have to sneak out and go back to Monterey. But before that, any quick questions for me? I also left contact. You're welcome to reach out to me at any time with any question, and I will respond. And any questions before I step away? Anything?
Well, I do have information for Dr. Adams if you all would like that. And if you do have questions and he is gone, write it down and we can
Yeah.
certainly reach out to him and make sure you get that question answered.
Yeah, I am happy to answer questions. Our faculty, we'd love, if you want to visit the campus, we'd love to get you down there. You want to go to a sporting event or anything, or go, if you're coming down to the professional soccer team, they built, the stadium is on our campus, the Monterey Union. So if you're coming down that way and want to see anything or see our labs, please stop in. Love to treat you. So I appreciate it. Thank you. Thank you. I'd love to listen, but sorry.
Tony?
Yeah, I can go next, sure.
That sounds nicely.
Yes, it was right on time. Hello, everybody. My name is Tony Tognetti. I am a licensed physical therapist. My technical degree is a doctor of physical therapy. I've been a practicing physical therapist for almost 20 years, so I've got a lot of experience under my belt. I grew up in Gilroy. I went to Gilroy High School. I went to Gavilan College from 1996 to 1998, so I've been in your shoes. From there, I went on to San Jose State and got a degree in kinesiology with a minor in pre-physical therapy, right? So basically taking all the classes you need to take to set yourself up for going into physical therapy school. And I was taking inventory of the room here, and I see mostly females, right? Physical therapy is heavily dominated by females, just so you know. 60%, I believe, maybe even upwards of that, of licensed physical therapists are women. Right, so I do a very specific niche. So I'll back up here. So once I was done with San Jose State, I went down to the University of Southern California in Los Angeles and got a 3-year doctor of physical therapy degree. In that time, while you're in school, you do internships, you take a ton of classes, obviously heavy science-based, and you get your feet wet treating patients. And then after that, you take a license exam. So you have to take a big test, pass that test. You also have to take a law exam to make sure you know how to practice, ethically and legally. And then once you get that, you're out there and you can go to work. My career path was, I knew I always wanted to be in outpatient orthopedics, so, kind of typical sports things that you see, guy go down or gal blows out an ACL, someone pulls a hamstring, or, our older patient population, people with arthritis, they get knee replacements, right? And it's in a private clinic, outpatient, so you go to the hospital, you have your surgery, you come to see us afterwards in outpatient clinics. I have 3 locations in the Bay Area. My physical therapy company name is called Apex Physical Therapy. We have locations in San Mateo, San Carlos, and one in San Francisco. And we do everything from 10-year-old, adolescent kids to 85-year-old, older geriatric patient population that has all sorts of age-related complications. I'm fortunate enough to work in the high-end sports world as well, so I work with professional athletes in all types of sports, names that you would know and names that you probably have heard over the years. So that's my specific niche. But physical therapy as a whole is a huge dynamic range of professional options, right? I do one small niche of that. You can work with kids, you can work with people with neurologic conditions, you can work with people with degenerative conditions, you can work in hospitals, you can work in homes, there are so many options in terms of physical therapy that you can do. And it's really, finding the niche that works for you and something that you like. And this is when you're in school, you'll get lots of opportunities to figure that out. I kind of cut my teeth in the profession as working as an aide, as Ken was talking about. You work in a physical therapy clinic and see what happens there and figure out if that's something you want to do, right? Do you like working with people? Because, you're going to work with people. If you don't like talking to people and you don't like working with people, don't go into this, because that, as he was saying, that's what you do. You're front facing. You have to have, human relationships. You have to be able to communicate with people. You have to be able to establish a rapport and trust. You also got to get people to buy in. And you also do this. You also wear a lot of stuff, right? People are throwing lots of things on you. So you have to be able to, wear people's emotions, wear people's struggles in life, because it expands far reaching than my knee hurts. Trust me. You'll get deep in the psychology of people's lives if you treat them, long enough and are able to, work with them in that sense. So once I kind of, for me, my career path where I'm at now is where I wanted to be. I worked backwards from kind of the end game there, which was, I always knew I wanted to have a private practice and be in the sports world. So for me, I geared all of my professional education towards that, and I kind of worked backwards from there to get where I am now. Once I graduated from physical therapy school, I worked 1 year in a private practice office, and then I started my own company with my business partner, and we've been doing that for almost 19 years. So I had opportunity younger in my career to go into private practice. They will not teach you the things you need to know to run a private practice in physical therapy school. So you have to dig, you have to be willing to learn things on your own if this is what you choose to do, which is the private practice world. But again, there's lots of different things, lots of different ways you can become a physical therapist and, help people move better in their lives, help people live better quality of life, and have a very, fulfilling career. If you talk about in demand, physical therapists are widely in demand. There's not enough of us out there. If you want a career that will employ you from now until your career is over, this is a safe place to go. The demand is just going to go up as people live longer and want to do more as they age. We're already short. Finding qualified physical therapists is one of the biggest challenges I have in running the company. The second challenge is getting paid, but I could stand up here and talk about that too long. And I won't bore you guys with that because that's not where you're at. There's just lots of different places you can go with this. Some of I think the key things, for me as I work back from that was you have to put in the work. No one's going to give it to you. It's not going to be handed to you. You're not going to say, hey, I'm a physical therapist, hire me. You have to put in the work and kind of know where you want to go in your career. You don't need to know it right away. You don't need to know it sitting here in this room. But at some point when you get out, know what your passion is. Follow that passion. If it's working with kids, go work with kids. If it's working with older folks, go work with older folks. You want to be in sports, find the sports clinic, right? But you got to put your nose to the ground. And no one's going to send you people and send you business until you've put in your time and you've put in the work to get to that point. And that's just kind of the reality of human relationships and word of mouth and how you establish yourself in a community. My typical day, I'm still in the trenches treating patients. So I've, like a lot of medical specialists out there, I've chose to specialize in the niche of what I do, in that I only see like shoulders and knees. So I don't treat spine injuries. I see some elbows, ankles, and hips, but the majority of my caseload is shoulders and knees. And that was a path I chose when I went into this. And I think that's an important take home. If you know what you want to do, then just focus on that, right? If you don't know, then do everything and figure out what that is that you want to do at some point. And I see anywhere from 20 to 25 patients a day in a 10-hour day. I work 4 days a week, really 3.5. At this point in my career, I'd say 32 to 35 hours a week in patient care. The other stuff is administrative stuff and business things. I have Fridays off, so I don't work on Fridays. I have a 3-day weekend every weekend. Work-life balance is fantastic in that sense. If you do the math, which I did, for every 7 years that goes by, I get one whole calendar year, 352 more days off, right, for every 7 years. And that, in terms of giving you other things to do in life, it's a great profession, right? You get lots of free time to do other things. And, I like work, but I also like playing and doing other stuff. So I don't want to spend all my time in the clinic, nor do I want to, miss out on all the things that go on in my family and my kids' life. So from that perspective, it's a very, very flexible. Let's say you want to have kids, right? You can work 3 or 4 hours a day. You can work when your kids are at school. Let's say you only want 2 days a week. You can do that. There's so many options and so many ways that you can do it. I think that's one of the huge benefits, maybe Donnie would agree here, of healthcare, is that you can make it what you want, whatever that is. You don't have to work 40 hours a week. You can do what works for you. And the demand is there that you will have the ability to kind of dictate that. So that's a very, very real thing for flexibility. Looking at my list of things Nikki said to talk about here, we could talk about work-life balance. How long did they talk for? Well enough? Anything else anyone wants to hear?
I have a question for you.
Yes, go.
Do you guys do anything with like stem cells?
So, okay, I can get into stem cells are the wild west of called biologics out there. So there, if I can get into it, it's kind of snake oil right now, if I'm being honest, right? There's not a lot of efficacy for taking stem cells out of your hip and shooting it into your knee joint and saying, hey, we're going to regrow your cartilage. There's not a lot of that's not proven, to be frank. So some of it is, and I'm talking specifically with orthopedics, right? I'm not talking about other parts of the body. I'm talking about specifically for what I do. Insurance won't pay for it, so that tells you something. They only pay for things that work. So it is a cash grab, in my opinion, from docs at some level, because it costs you $3,000 to $5,000 to go get one of those shots, okay? And it's cash, and there's no insurance going to pay for it. So when people ask me that question, this is the answer I give them. If you got the money to burn and you want to try it, and maybe it'll work, if you tell me it works, then it works, but the science doesn't say it works. And if it's, if the money's there and you want to burn it, go ahead. That's no skin off my back. But there's not a lot of efficacy for it currently. So.
Other questions before we move on? Yeah, go ahead.
You said that you're at where you wanted to be.
Yes.
Now. What exactly is it that you do though, like specifically?
So I treat patients with orthopedic conditions, right? So if you were to twist your knee and have a surgery on your knee, you would come to my office for the rehab part of it afterwards. If you have a sore shoulder, and you go to your doctor and says, "Oh, I recommend physical therapy," you would come to my office, and I practice that physical therapy, right? So I prescribe exercises, I perform hands-on treatments, I help give you advice on things to do. That's kind of what that looks like. And I see people, typical physical therapy prescription is 2 times a week for 6 weeks, so like 12 visits, right? But if you have a substantial surgery, I could see you for 9 to 12 months. So my high-end athletes that tear their ACLs, they're in my office for 9 to 12 months. A whole year of your life you spend in my office, which is crazy. Some people have spent longer than that if they get complications. So when I talked about getting to know your patient, we develop a relationship, right? You come in that often, I'm gonna know about your family, I'm gonna know where you grew up, and you're gonna know about me. But that's the stickiness of what we do, because it's not just providing treatment, but it's also creating a relationship. And that is the number one thing I teach my younger therapists. I don't care what you do with someone on day one, how you touch them, your questions you ask, your tests you perform, the exercise you give. If you can't establish this, if we can't establish some level of trust and some level of a relationship, we're not. There's nothing to build on. So that's the most important thing we do on day one, is just establish some level of rapport between me and you. Did I answer your question?
Yes.
Okay, great.
Other questions? Yeah, can your hand up? Raise your hand.
Go ahead, please ask questions. Fire away.
Well, you said that going off the shifts,
Mhm.
how did you know that you wanted to become a physical therapist?
So yeah, good question. I didn't really allude to that. So I played sports in high school. I played sports here at Gavilan. I played sports. I played baseball at San Jose State for 2 years there. And so being in that environment, you're around the gym, you're around a training room, and you kind of get exposed to injuries, to working out, and that specifically applies to what I do because of the sports and the orthopedics component. And I guess I can take a step back from that. At Gilroy High, there was a sports medicine course offered by Dr. Morjohn back in the day, or Mr. Morjohn. And so that was probably the first place I got my feet wet with it, was, taping ankles and learning kind of that athletic training environment. And then I thought about being a trainer, and then I went into a physical therapy clinic, and I saw You know, I think the options are a little bit more available as a physical therapist. And so I pursued that path from those experiences.
Great question. Other questions?
Yes.
Do you also work with a lot of OTs?
So OTs occasionally, but they tend to be more in the hospital. You know, that tends to be an environment where OTs work, or they work with hands. So hand therapy is another specialty, and a lot of occupational therapists work with hands. We don't have an OT on staff, so I don't work with a lot of OTs. But they're either, you know, hospital-based or like hand therapists, or what a lot of them
Do the OTs do like the splinting?
Yes,
for-
exactly.
You
So
guys
we don't do that. It's
Okay.
a specialty in and of itself. You know, I wouldn't be able to tell you the first thing to do with splitting a hand, just like I wouldn't be able to tell you what to do when you hurt your back. Okay, because that's just not what I treat. And I'm the first person to admit that I don't work on that stuff. You know, but yes, they're the ones that do those things.
Okay, interesting.
Yeah, go ahead.
Was it you born or grew up here?
I was born in Gilroy, grew up in Gilroy. My family's been in Gilroy for 5 generations, if I'm being honest. But I work up in the peninsula. It's kind of by the San Francisco airport, Burlingame, San Mateo, and I live up there now.
So you don't have any office?
I don't have any offices down here. No. Nikki brought me down because I'm, you know, from here, and we know each other from way back. So.
But if you're in need, I'm sure you'd give a good referral.
Yeah, and you know, if you guys, and like Ken said, you know, if anybody has questions outside of here, I'll give Nikki my email, and you guys can reach out, ask questions, or you know, if you need any specific guidance in that sense.
Other questions?
I have a question.
Yes, sir.
As someone who works with students with disabilities at
Mhm.
college, you're talking about shoulder and knee issues.
Mm-hmm.
Going to graduate school, obviously I didn't do the type of schooling that you did.
Mhm.
How would one go about in kind of looking at a basic program, or to look at common injuries that students?
Yeah, like where would you get like informational stuff about
Yeah.
that? Yeah, the internet's an amazing resource now. You know, for really, if you've got enough of a sense of anatomy, and you know, there's some great physical therapists out there that put out a lot of content. You know, online, whether it's through educational things, and I can give you some of their names if you want specifics on that. From educational content to, you know, lots of different ways to learn. I mean, you know, continuing education is another thing. Even if you're not a physical therapist, you could sit in on that stuff and learn about things. But the online resources are there, and I have some great names that put out a lot of good content, specifically, you know, regarding orthopedic conditions and stuff like that. So, I mean, that's another thing. I mean, the power of the internet is real, and the ability and the resources you guys have in your generation that we did not have is allows you to see a lot of things and get a lot of exposure to a lot of different things. So take advantage of that. There's a lot of follows you can do and get your, you know, get experience and see what happens. You can learn, you know, on your phone now, where before you had to get your butt in the clinic to figure it out in the training room. But now you can just pull up your phone and, you know, follow a few things and get a lot of at least, you know, introductory sense of what happens in a specific niche. You want to work with kids, you could, you know, or whatever. So you can get the information.
And then did I, was it Nick that was gonna go?
I think so. Yeah.
Thank you.
Okay. All right. Hi, folks. So my name, once again, is Nick Calvin. I am the Deputy Director for the Health and Human Services Agency down in Hollister, so for San Benito County. And so my job is really to run the public health department for the county. So I have a master's degree in public health, and then I also have a doctorate degree in law. And so my background is probably a little bit different than what the typical way to get into public health would be. So most people who I hire or who work for my agency or surrounding agencies get a degree, a bachelor's generally, in some sort of health science. So kind of great where I'm assuming most of you guys are. getting a degree in something that is not necessarily has to be in public health, but related to public health or to healthcare as a whole. Those are most of the people that work in my agency or kind of surrounding agencies. But just to kind of get started on how I came into the role that I am in now, and then I'll talk a little bit about the public health field. So I got my bachelor's degree actually in biblical studies from a small college up in Iowa, and then ended up going to law school where I attended for 3 years. And during that time, they offered a opportunity to get your law degree at the same time as your public health master's degree, your MBA, and MPA. There was all sorts of different joint degree options. And so one of the things that I decided to do was take advantage of that opportunity. I was able to get both degrees in that 3-year time period. And because of that, at that time, I was planning to be a lawyer, to go into a law practice, probably corporate law or something like that. But I said, maybe it would be helpful to have, it's always helpful to have some additional background or expertise. And so I ended up getting my MPH at the same time. It was a completely online program, which is something that I think if you do get your bachelor's degree, it doesn't really matter what it's in. A lot of MPH programs are online, and most of them that at least I've seen don't require you to have a degree, a bachelor's in public health. Some do, and that's a requirement, or some programs are more difficult to get into, and that helps you a lot. But for example, the program that I did, I went to the University of Alabama in Birmingham. I don't know if you can tell from my accent. Sometimes it comes and sometimes it goes away, but I'm from Alabama. And so that's where I went to school, and a completely online program where I learned about public health while going in person and going to law school. And so after I graduated, luckily I had worked for several years at a pharmacy as a pharmacy director. I had originally planned to be a pharmacist before going to law school, and had worked throughout high school and a little bit of college at a pharmacy. And so I kind of took over when the owners pseudo retired. I kind of took over managing the pharmacy. And so that really helped give me some management skills that I was able to translate into future work. So after I graduated with my law degree and my master's in public health, I looked all around the Southeast for a job in public health. I applied for a lot of places, and it was right in the summer of 2020. So COVID was running rampant, and there were a lot of jobs, but a lot of jobs that they wanted specific people for, people with specific expertise or backgrounds. And so there really wasn't a lot in the Southeast that I qualified for or that I wanted to do. And so I kind of looked elsewhere and ended up finding a job as a public health director in Oregon for a really small county. So it was about 8,000 people in the county, and they hired me because of my MPH, a little bit because of my law degree, but specifically because I'd worked as a manager for several years to run this small health department. So one thing that I would definitely encourage you guys is be flexible. Sometimes you don't know where life is going to take you, and it may not be the exact path you want to go down. I did not anticipate that I would move from Alabama all the way to Oregon, but the job was a great opportunity, and I wasn't going to be able to run a health department straight out of graduate school in Alabama where I was at. It was in a big city, obviously. And so I took what opportunities were there. First, starting with getting that MPH in the same amount of time as my law degree, then getting this position in Oregon. So then I worked there for 2 years at a health department that was also a joint rural health clinic. So really learned how to manage not only the public health field, but also work with clinicians, so doctors, nurse practitioners, physicians' assistants, and worked there for 2 years before actually moving down to Hollister, where I currently work and have for about, it'll be 2 years in April. So that's kind of how I came to be where I am at now. And like I said, I run the health department down in Hollister for San Bernardino County. So just to kind of give you some background on what is public health, why should I even consider it as a field? Are there any jobs in public health? obviously, I think everyone is well aware of COVID, and that kind of brought public health into the forefront of people's minds when before that, no one really knew too much about it, or there wasn't very many people paying attention to it. So I think that the pandemic, while tons of negative things, did bring to light the importance of the public health field and why we should have, especially young people in college, looking into maybe joining it and seeing the merits and the benefits of working in public health. So that's kind of what I wanted to talk to you guys about, and I'm happy to answer any questions after about why you should at least consider a job in the public health field. So public health is very broad. A lot of people probably think, oh, it just has to do with COVID, but public health encompasses a ton of things. And one thing you guys may not know is we are tied with physical therapists. So I employ an occupational and a physical therapist to work at a therapy clinic that is through the health department. So that is one of the many, many areas that public health has workers in. So you can kind of, if you get either a bachelor's degree in public health, if you get a bachelor's degree in something else, and then get your master's in public health, you can kind of go down several different paths in order to get into the field or get into the industry. Some are working with nonprofits, some are working with government agencies, some are working with private organizations. Public health is expanding. There was a lot of money thrown into the public health industry because of the pandemic, and a lot of that was from the federal government. And so a lot of that has translated into new jobs, some that were limited term because of COVID funds expiring, and some that became permanent because a lot of the legislatures realized that public health was criminally underfunded before the pandemic came, and we were not prepared for a lot of the elements that came whenever COVID did in 2020. And so there are a lot of jobs in the field. You can go on Indeed right now or ZipRecruiter and look, and there are thousands of different jobs in public health spread throughout the country. And they're not all just working for a health department. You can work in policy, you can work with legislatures in enacting healthcare policy. You can work for health insurance companies to work with getting reimbursement rates increased, working with those legislators who may be able to enact changes on that. You can also work in the research field. So a lot of people who go on to get either their bachelor's in public health and then their master's, you can also get your PhD if you want. And a lot of people who do that go on to work in the research field. So if you're really interested in data, if you like looking at spreadsheets and like looking at how disease or how different health outcomes impact the population as a whole and how we can change things to improve that, then a career in epidemiology might be for you. A career in public health where you're working as a data scientist. The CDC hires, and obviously it's a huge organization, has thousands and thousands of employees, but you don't have to go all the way to Atlanta to get a job working in that. You can always work for the California Department of Public Health, or you can look at some of the counties that are around us, including ours down in San Benito, that hire epidemiologists to work with data, to work and look at disease trends to figure out how we can have a positive impact to minimize disease spread throughout the area. So there's the policy route, there's the data route, and then there's the route that I chose, which is kind of the community health route that can turn into leadership. So you can really go down two different paths here. The first would be getting your bachelor's degree in something. What it is, it kind of can be up to you depending on how you want to jump into the public health field. So I hire all the time all sorts of different employees. So I have health education associates that I hire, health assistants, epidemiologists. I even hire program managers and even office assistants. So we have a wide range of different types of employees that work where I do at a health department, including PT and OTs, including doctors, including nurses, tons of different ways that you can get into the public health field. So don't just think public health is COVID. Public health is massive, and there's so many different ways that you can get into it and get a job that is stable. Most of the time, government jobs are less likely to see job cuts than the private sector. They're a little bit less wary of recessions. And so generally, depending on what county or state you're in, the benefits for these type of jobs can be pretty good, and be able to have room for advancement. And so I know that government jobs sometimes can get a bad rap. But if you actually look at some of the benefits of working in these different sectors, especially when you look long-term at pensions and things like that, it can really be a good opportunity for you to get into a stable career field where you're really making a difference. That's something whenever I interview people, I'm trying to figure out is what is their motivation. So another thing I would encourage you guys, regardless of if you're interviewing for a job in healthcare or public health, whether you're trying to be a PT or OT, kind of or really anything, what's been said today is make sure that you have a passion, that you have a desire, and that you can work with people. I've interviewed PTs because we had a vacancy multiple times throughout the past year and a half that I've been here, and in my previous roles. And with that and other jobs, I've had people who are more than qualified for the position that I love their resume, but when I interviewed them in person, it was terrible. It just was not a good back and forth. You could really tell that they were not going to have a good rapport with the patient. And that is really, I would say, one of the most important things, regardless of what field that you go into, is if you are going to be working with patients, like I said, for me, it could be a doctor, nurses, or a therapist. You really need to be able to create that rapport with the clients, with the patients. It really doesn't matter how much you know if the patient's going to be uncomfortable and doesn't want to work with you. And so really make sure that when you do go into these job interviews that, it could definitely be nerve-wracking at times, but that you try and put on your best face and that you're showing people why you want to be there and that you can bring a benefit to their organization. So I know I've probably about to go over time here, but my main selling point, hopefully, is there's a wide range of things you could do in the public health field. You don't just have to come in and work with COVID. You can come in and work as a health educator, doing outreach opportunities where you're educating people on the dangers of tobacco, or on nutrition education, on, to kids in schools about what foods are best to eat. You can come in and if you decide to go to nursing school, come in and work as a public health nurse, investigating disease outbreaks, whether or not it's bird flu or a communicable disease like, gonorrhea, or you're looking at tuberculosis, HIV. You can always do investigations like that. Or you can go about it many, many other different ways, coming in as a therapist, as a pharmacist, as doctors, even as office assistants. There's all sorts of a wide range of jobs that the health department has just down the road in Hollister. And I would encourage you, if you don't want to go down that way, that San Jose, Santa Clara has so many different jobs where you're really making a positive impact on people's lives, or go out to Salinas and work at Monterey County or Santa Cruz. So happy to answer any questions that anyone has. Sure.
You said you went to law school while working as a pharmacist technician or in a pharmacy, and how did you handle it all at once?
Yeah, exactly. Yeah, so basically, yeah, exactly like you said, I worked as a pharmacy technician because I hadn't gone to pharmacy school or anything, kind of managing the operations of the pharmacy while doing law school and the MPH program. And that was really tough. It was pretty much going to school full-time and working a part-time to full-time job. And it was all about time management. So I would go to school in the mornings. This is my second and third year of law school where your schedule's a little bit more flexible. I go to school in the mornings for law school. Then in the afternoons, I would either do my MPH program or I would go work at the pharmacy. And then the weekends, I would be at the pharmacy working because I was married at the time and needed to pay bills. And so it was all about being able to manage my time correctly. And those 3 years flew by when I didn't have a lot of free time. So that was one of the benefits, because law school can drag on for a lot of people.
What's the pay like in public health?
Yeah, so great question. So like I said before, government gets a bad rap for a lot of reasons. Pay is one that is definitely justified for a lot of positions. So when you come in, it depends on what position you're looking at. So all of our pay scales, if you're looking down in Hollister, now or after graduation, or if you go get a master's, it's all online. You can just go to the San Benito HR website, and all of our pay scales are there, so it's transparent, so you see what you would be making. And it is very difficult to compete with the huge counties, with Santa Clara, Monterey, and even Santa Cruz. So all those counties pay pretty well, from what I can tell, compared to the national average for public health workers or people in that industry. And then Hollister, down in San Benito, we try and be as comparable as possible. And so it really depends on what the position, but you can make from as little as, maybe $14, $15 an hour, all the way up to, if you're a doctor working in public health, you can make $200, $300 an hour. So there's a wide range of different possibilities depending on what you want to do. Nursing is definitely one of the most in demand, not just in public health, but in general industry. And so nurses are paid very well in the public health field. Not as well as maybe if you're working for a hospital, but the positive of working for public health is that a lot of times you have flexibility that the hospital doesn't. You're not going to be on call. You're not going to have to be coming in at nights or on weekends. So, yeah, great question. Yes.
You had mentioned about it was, you said San Diego HR or something?
Yeah, so I work for San Benito County Health and Human Services. So because we're through the county, our human resources agency handles all of our hiring and pay and everything like that. And so if anyone's interested and wants to see, okay, what's the job look like down in San Benito, all of our jobs are listed on our human resources website, as well as our pay scale, our policies and procedures, so you can see exactly what it would be like to work for San Benito County, whether it's the pay, the benefits, or your just everyday work.
So how exactly would you be able to get into HR?
So getting into human resources as far as like applying for a public health job, or as far as working for HR?
For public health jobs.
Yeah, so all you have to do is go onto their website. It depends on what your background is, but we have a wide range of jobs that become available all the time. Sometimes we have 2 or 3 open, sometimes we have 10 open. And so I would say just monitor that website. You can always just Google San Benito County jobs, and it should pop up. And just monitor that website to see what jobs are available. And then we have job descriptions. I have many with me, so afterwards, if anyone wants to see, kind of what the different job descriptions look like. We have all of our job descriptions listed online with what the job entails, as well as what you need to apply for that job. And so some of them can be robust. For example, our epidemiologist, you need to have some background for that. And then some other jobs, like our program manager job, you need to have 2 years experience, kind of working in a similar role as a supervisor, and a bachelor's degree in either social science, public administration, business administration, or related field. So the degree is really not something that I look for as much, depending on what the position is, as your drive and desire to work in the public health field. We really do impact and change lives, like I think most of us up here do. And that was the thing that really drove me to public health, is I can really make an impact on my community by improving the lives of them through my work. And so a lot of people that come and I've hired may not have had a bachelor's degree in public health. And I was okay with that. And I think a lot of other employers are. if you're coming in with similar background, for example, I have 4 or 5 employees that have kinesiology backgrounds. And so we don't really do a lot of that work at my office, but they had some science knowledge and then came in and really wanted to make a positive impact on the community and work in the public health field and grow in that. And so we hired them on and we mentor them and we coach them. A lot of them go on to get their master's in public health degrees either while working for us, or they'll leave school, or they'll leave work, go to school, get the degree, and come back. And so we're really just trying to grow people within our field and our industry. And that's the great thing about working for a smaller county like San Benito, is the pay might not be as great as in San Jose, but you're going to have a lot more opportunity to learn skills, have that more one-on-one time with supervisors, with the director, myself, and be able to grow and expand your work. Yeah.
Okay, great. Well,
Great.
thank you.
Thanks.
Before moving on, let me comment one thing. The great question on the pay. My
Yeah.
starting therapists out of school make $90,000 to $95,000 a year. And we move up from there as they gain experience and skill set. So just wanted to throw that out there. That was a great question.
Yeah. Go ahead.
What's your website, or what is the website called?
So I'm not sure what the specific URL is, but if you just go to Google and do San Benito Public Health, it'll pop up, or the Health and Human Services Agency. So the way that it works for us and a lot of counties is public health is within the Health and Human Services Agency. So Health and Human Services does a number of things, works with homeless programs, works with public assistance, and so we're a branch or a division of that. So just Googling San Benito Public Health will take you right to us.
Do you guys list jobs on Indeed?
Yes, so a lot of our jobs are listed on Indeed, so you can go on there and look. Like I said, the county website links to governmentjobs.com, which is where most counties and a lot of state agencies use. So I would definitely advise, if you're looking for a job in government, definitely go on there. And the pay scales generally are on there. At least for our jobs, all the pay scales are very clear. And so you can kind of see what the range is that you might make, depending on what your background and expertise is. Yep.
Thank you, Nick.
Thanks.
And so we have Donnie Lynn, and then we also have, you saw Alyssa Giacalone walk in, who's also going to be speaking in just a few minutes. So welcome,
Thank you.
Alyssa. And Donnie, would you like to go ahead?
Sure. Right, my name is Donnie Lynn. I feel a little inferior. Everyone has all these degrees. I am an RN. My path has,
It's a very valuable degree.
it's taken me a while. My road has been long. I mean, I do feel blessed that ever since I was little, I mean, like 4 years old, like I just knew that I wanted to be a nurse. I wasn't quite sure how I was going to get there, but that's what I wanted to do. And school was always really hard for me. It just took a lot of focus. You know, some of my best friends, you know, they would get A's without even trying. Well, heck, I had to study my butt off, you know, just to get, you know, a B. So school definitely was a little bit harder for me. I did do the CNA program at Gavilan years and years ago. I did it over the summer just because, I mean, I knew and kind of felt that I wanted to be a nurse. You know, I kind of, you know, I was young. I, you know, kind of had an idea what it was about, but I thought, can I really handle it? Like, can I handle, like, the nitty-gritty, like, the blood, the poop, you know, all that, making the beds, moving patients. And so I thought, okay, well, they offered the CNA class during the summer. So I took the CNA class over the summer. And I thought, yeah, you know, I can handle that. It's definitely a hard work, but, you know, I enjoyed it. So I did the CNA class. After I graduated, I I'm from here, graduated from Gilroy High. I've lived here my whole life. I wasn't quite sure, I was going to go to Gav. Then I decided my social life was always very big as well. So I decided to move with one of my best friends up to Chico. So then I thought, okay, well, they have nursing at Chico State. So my goal was to start taking prerequisites and hopefully get into Chico State. So I started out at the junior college there, which is actually in Oroville, Butte College, and I was meeting with a counselor, and she says, well, it looks like you have everything to apply to our LVN program. And so I said, okay, well, why not? I really didn't think I was going to get in. At the time, their program was like a lottery program. I guess they just kind of pulled from a hat, and I was chosen. And so I thought, okay, well, I guess my path is I'm doing my LVN right now. So I got my LVN through Butte College in Oroville. And my goal always was to continue my school, become an RN, but life and other things, life doesn't always go as planned. I mean, I think most of the time it never goes as planned. But, if you know what you want to do and you're passionate enough about it, then you just, you don't give up and you just stick to, your goal. And so I decided to move back to Gilroy after I got my LVN because I thought, well, if I'm going to meet a husband, he's got to be around this area. So I moved back home. I actually did meet my now husband, so was having fun with him, I was chipping away at my classes really slowly, like, microbiology and different things like that, because I thought, okay, well, maybe I'll, go to San Jose State, but I still wasn't quite sure. Knew I still wanted to get my RN, but was having fun, and working as an LVN. But then I got married, I had kids, and so I still slowly kept chipping away at my classes. And now I just graduated from Gav's RN program in May. My girls are a little bit older, though. They're almost 18 and about 14 and a half. So it was a little bit easier going through the program with my kids being a little bit older. I did apply a couple times to the program and was upset each time that I wasn't accepted, but because it is a very competitive program and a competitive field to, as far as schooling to get into. But in reality, I couldn't have done it with two really young kids. A lot of people, go through you have to have a ton of support. That's not, you need a lot of support to go through the program. But, so now I'm working as an RN. I was an LVN about 22, 23 years. So I just became an RN this last year. Most of my work as an LVN has been, I've done a bunch of stuff, but most of it has been pediatrics, because that's kind of where my heart is. Special needs kids. I've mainly done in-home care with kids that are healthy and stable enough to be at home, that they don't have to be in the hospital. Most of the kids that I've worked with over the years have some sort of a disease or had an accident or something where they have a tracheostomy to help them breathe and are on a ventilator to help them breathe. There's been a whole range. Some of the kids are able to talk, some of them are not. Some of them are bedbound. there's kind of two different aspects to home care. The home care that I've done is the patients that I've cared for, they need 24-hour care usually. Like if, the baby is hooked up to a ventilator, mom and dad can't ever leave that child alone, or, they can pull out the tube and then they can't breathe, disconnect themselves from the ventilator. They need someone to watch the baby at night so they can sleep. So this person, needs to be a qualified nurse. So I go into homes for like an 8 or a 12-hour shift. I know there's, other home care where, they kind of pop in and do visits, like maybe someone has a wound and, needs a dressing change or something like that. But I have my specific patients, and I go into the home and, and stay for so many hours. So just like everyone else kind of said, you need to be, you don't necessarily have to be a people person, but I'm walking into somebody's home. I mean, I get there in the morning and they are, in their pajamas, or, their younger kids are running around in a diaper. I mean, I see everything and hear everything, and you need to be able to, kind of know your boundaries and come into someone's home. And yeah. What else? Any specific questions? Yeah.
Is it palliative home care that you do?
The agency that I work for, they do children's hospice as well as kids with cancer and things like that. I've worked for a couple different home care agencies. Mainly the kiddos that I've taken care of are stable and are, expected to survive. But the agency that I work for, they do have like hospice care for kids that, have cancer and aren't expected to survive as well. And with over the years, I've worked for Hollister School District. I've worked for Morgan Hill School District, where, there was a specific child that needed a one-on-one nurse to go with them to school because they were in a wheelchair, on a ventilator, had a tracheostomy. They were fed by G-tube and needed injections and maybe had seizure precautions. So I'm their like personal nurse, and I went to Sobrato with a student, and I got to redo my whole high school all over again, and I learned so much more the second time around when I was in my 30s versus my teens. But I've went on vacation with parents, because if they want to go on a vacation and they have a child that, details and things have to be worked out with the nursing agency. But I've gone on vacations with patients, and yeah. And my job is pretty amazing. And my patient that I have right now, I love my job, yeah. There's so many, when you go into nursing, there's so much. I get excited thinking about it. I'm like, well, gosh, I'm already getting old. I should have started this so long ago, because there's so much I want to do. You don't have to work, in somebody's home. You can work at the hospital. You can work at a clinic. You can do the public health. Yeah, there's a ton. But
Very in demand.
yeah, there's a ton of jobs. And so I graduated from Gav, and I'm chipping away at my bachelor's now online with Ohio University. So, and doing home care, I've always established really good relationships with the families that I work for, and I've really been able to make it work really good for, I've been able to work like part-time, be there for my girls and their different, because my kids and my family are number one. Of course, I have to survive in the Bay Area, but, I've been able to, be there for their different things and, yeah, because as a woman, you have kids, and that does take away, some of your time. Yeah.
So with the nursing program itself, without like the stuff that happened in between your life, like how long did it take you to fully get there with the CNA program, the LVN program, getting into the actual nursing program, and then getting to
I mean, it's very individual. It definitely depends. Back when I, was applying and got into LVN school, it wasn't quite as competitive, but that was 23 years ago. So I didn't have straight A's and got into an LVN program. But then as I went on, and applying to different RN programs, I realized how competitive it was. So, I mean, I was trying to compete with all these younger kids that have all straight A's, and I mean, I retook some of my classes that I had maybe B's or C's in to get A's. I didn't have straight A's, but I mean, how long would you guys say? I mean, what the LVN program is 2 years now?
3 semesters.
It's 3 semesters. Okay. And then the RN program, I mean, I started in August and finished in May, so.
I usually tell students to expect 5 years with all the prereqs, and that's if
Yeah.
you're going full time. Yeah.
So with the RN program itself, I know you have to have years of experience in the medical field. Is it just LVN program and the CNA program, or could it be expanded to like the CMA or like working in a clinic as a receptionist? How does getting into the program itself, how does it affect getting into the program itself?
So yeah, work experience, any type of work experience, as long as it's direct patient care, that does help you with your application, for sure. Is that what you're asking?
Well, because I know that CNA and LVN work more directly,
Yeah.
and those are more prone for the nursing program. But when you're a CMA or if you work in the in the clinic as a receptionist or as like just working there, does it have any effect at all in getting into like the LVN program or getting into the RN program?
So not the LVN program here, because we are a lottery, just like Donnie was talking about. Her LVN program is a lottery, so there's nothing, unfortunately, that you can do to increase your chances for the LVN program. But for the RN, yes, if you medical assisting, CNA, phlebotomy, we have a whole list of different certifications, EMT. If you have those and also have work experience, then that gives you extra points on the RN application.
And then with the lottery, how many schools are more of a lottery and how many are more work ethic? Like, you have to apply and see if you have more like better stuff in your resume or your application than the other person. Like, how do you compare which schools are more lottery and one is more experienced?
So for LVN, you just have to do your research and see which schools are out there, right? I mean, and we can, I don't know if we've met before, but we can definitely plan a time to look at different LVN programs. As far as in the area, the other community colleges that have LVN programs are Hartnell, Mission College. And Mission College is very similar to our program. So it just depends. I mean, yeah, they're all a little bit different.
It's hard and it gets confusing because I remember, I mean, when I was like, okay, I have everything to apply to GAVS RN. And then I'm like, okay, I apply. And then I'm like, well, I would love to get into Gav, but, you know, I had to apply. I applied to like Hartnell, to Mission, to Monterey. But is it a lot? Like, do they all have to be the same for, because no, right? Because I remember for Monterey, I had to retake a class or two. Yeah. So some of the
And
school.
I want to say just for Donnie, I've worked with her for quite a few years, and I just remember like having to tell her, okay, now statistics is going to be required, and she's like, oh my gosh, I have to take another class, but she did it, and she kept persevering, she kept applying, and
Oh, you guys, I mean, I was just talking about it with my husband last night because I'm just like, oh my gosh, remember all those night math classes I would have to take? I would go to work all day as an LVN, and then I would have, thank goodness, I have such a supportive family, and all my family's here. You know, I would have one of the grandmas pick my girls up, and then, you know, my husband would make dinner, and then I would go to class until 9 o'clock, and then come home, and, you know, and then sometimes get up at 4 o'clock in the morning to study for a math test I would have that night, you know, but I mean, it was what I wanted, and I mean, time's gonna go by regardless, right? So, I mean, you might as well be working your butt off to get somewhere to improve your future. I didn't think it was gonna take me till I was almost 48, but hey, it is what it is, and I hope that, you know, I'll get my master's one day, you know? I'm just gonna keep, yeah, and my kids are like, what, you're back in school again? I thought you were done. And I'm like, girls, I'll probably never be done. But, I mean, I like to learn. I love to research. I mean, it's what I love, you know? And I feel blessed that I knew that I wanted to be a nurse since I was little, but like my girls right now, my oldest, she'll be 18 in a couple months, and she doesn't really know what she wants to do. So I keep telling her, well, you know, what are your hobbies? What are your interests? What do you like? You know, and she loves her horse and horses. And then, you know, if you're not quite sure, you just have to think what you like, what are your hobbies, what are you interested in, because work is going to be a big part of your life. So you know, hopefully you enjoy it.
You mentioned masters. Are you looking to be a nurse, like, how do you say, a nurse practitioner?
I don't really know. I would, you know, it's just kind of a goal of mine to, after I finish my bachelor's, you know, hopefully, yeah. Because, I mean, I guess, you know, my girls are going to grow up and move out one day, and, you know, then maybe I'll have a little bit of a life again.
maybe she'll come back and teach us.
That would be, yeah, that would be fun.
We'll be happy to have you back.
Anybody else had their hand up?
Yeah.
How exactly did you get into the home care field itself?
It's really kind of funny how I went into it. After I became an LVN, I did work at a hospital for a while, and then I moved back to the area, and I was really just looking in the newspaper at the time for jobs, and I saw that an agency was hiring, and they were willing to train you to work with children on ventilators that had tracheostomies. And when I was in LVN school, tracheostomies, they scared me. They scared the crap out of me, because I'm like, that tube comes out, and that person, you have to put it back in so they can breathe. And the ventilators, that made me nervous and everything. So I thought, I'm going to apply for this job. And I got it. And now I'm probably more comfortable working with patients and kids I'm so comfortable with. The patient that I have right now, she's almost a year old, and she specifically needs an RN. She was born with something called short gut syndrome, and so she was born missing her intestines. Some of them weren't fully connected. So in order for her to get all of her nutrition, she's fed through a central line up here, and then she also has a G tube where she's fed directly into her stomach. So that's my patient I have right now. But yeah, I went into it because I was scared and wanted to face my fear. Uh-huh.
And then overall, your entire journey, what was the hardest part?
What was the hardest part? Oh my gosh. I mean, just not giving up, I guess. I mean, you just have to keep going and trying, and math was not my thing. I mean, I had to take so much math. And I was talking with my sister-in-law one night, and my sister-in-law had just finished dental school. And I had kind of thought, well, it's too much. I'm going to give up. I'm just going to stop. And she told me that she says, are you kidding me? You know, you're going to give up because it's too much math or whatever. And she says, I failed chemistry twice. I failed my algebra 2 twice. And she's like, I just retook the class. She says, who cares if you fail a class? You just retake the class. And I mean, it sounds so simple, right? And I was like, well, yeah, I guess so. I guess you just I mean, nobody wants to have to retake a class. But if you have to, then whatever, you have to, you know? And math was a little bit harder for me. So, yeah, I did have to take algebra 2 twice. But whatever, I did. And yeah. It's not the smartest person that gets through it. It's the person that doesn't give up.
Any other questions for Diamond?
Yeah, and there's, I mean, a need for nurses. Like, get on Indeed or anything. There's so many jobs everywhere.
Well, thank you.
Yeah.
We have Alyssa Giacalone. Did you want to introduce yourself and what you do?
Yeah.
Thank you.
Sorry I was a little late today, but I'm glad to be here. Thank you for having me. I had a similar path in terms of took a little bit of time to get where I am, took a little bit of soul searching to figure out what I wanted to do. Grew up in Southern California, Thousand Oaks area, if anyone's familiar. Played sports and ended up getting hurt just as I was getting moved up from JV to varsity softball. And I ended up tearing a ligament in my elbow, which had me going to physical therapy quite often. And the physical therapist ended up working with the sports teams in my high school. So I got to know him. As we've talked about, you build a relationship and you meet someone who maybe inspires you or helps you figure out a path. And this physical therapist would show me, he had a little black book and he kept sports injuries in it. Each page was a different sports injury. So each week he'd teach me a different sports injury. And I wanted to get back into softball, but I knew it wasn't going to be something that I was going to be playing in college. So it was a way for me to be back with the team and help him as an assistant in his physical therapy office there on campus, to be still within the sports realm, still able to hang out with the athletes and feel like I was part of a team while I was doing my own rehab. So from there, I applied and went to college at San Diego State University, where I was initially in the kinesiology track, and decided to go with an emphasis in athletic training to be remaining within the sports realm of things, which is where I met Jamie. And athletic training was something that I loved. I loved being around the sports. I loved the injuries and helping people either prevent injuries and work on strength and conditioning, or rehab injuries and work on getting back on the field. And you were right there on the sidelines of the football games when someone went down, you know, you got to go help them. Or you were right there in the soccer game when two athletes go up for a header for a ball and they smack their heads, and you're there right to take care of, you know, the injured athletes. And I loved the adrenaline in that. Ultimately, as I'm finishing the program, I'm thinking about what I'm going to do next. And there were some people around me going into different avenues. Some people were going to physical therapy school to get their doctorate in physical therapy. Some people were going to physician assistant school to become physician assistants. And some people were staying within athletic training and either working at the collegiate level or trying to get into professional sports. And in San Diego, we had a lot of professional sports around us that we had internship opportunities with and stuff. One of the places I had worked at was the Olympic Training Center in Chula Vista for a short time. I did some events there. I was fortunate enough to be invited to do athletic training for some of the events. And there was an incident during a BMX event where the athletes come around this corner, and it was the crash corner. So I was put there as a medical person, and they said, there's going to be a lot of crashes here. We need you to be here. I said, okay. There was a big crash. One of the girls was face down. She wasn't breathing well. She was, having some distress to where they ended up having to fly her out of the area with a helicopter to the hospital. And I was first on the scene, and a doctor arrived shortly after. As soon as the doctor arrived, of course, I was told, hands off, the doctor's here. Sorry.
You're fine.
He likes men. So I'll get to him.
Sure. Just don't want him to get in trouble.
No. So doctor arrived on the scene, and the doctor got to go in the helicopter, go with the patient to the hospital. And I was like, man, I just feel like I wanted to be more. I wanted to know what happened to her. I wanted to know, how she did, and wanted to be there with her to make sure she was okay. So from that point, I started, the best advice I got at that point in life was to shadow as many people as I could in different professions within healthcare to figure out what I wanted to do. So for money's sake, I ended up working as a medical assistant in an orthopedic office where I could use my athletic training degree to work as a medical assistant, so I didn't have to go to medical assistant school. And during that time, I shadowed a variety of specialties. So I shadowed doctors, I shadowed surgeons, I shadowed nurse practitioners, physician assistants. I still maintained relationships with athletic training friends, trying to decide if that was something I still wanted to do and get a higher degree in. And what it came down to was that I wanted to be in a job that I felt like when I finished school, I wasn't going to be paying debt forever. And a job that I felt like wasn't really work for me because it was something I was very passionate about. And ultimately that ended up being a physician assistant. So from the medical assistant the medical assistant job, I got the hours of direct patient care to be able to apply to physician assistant school. I applied 3 years in a row. I applied first year to 15 different schools, second year to 12 different schools, third year again 12 different schools. And it was very competitive. Let me tell you, the essays you have to write for every single one, I'm sure it sounds daunting. It was, I'm not gonna lie, but it was something that I wanted. And the third year I applied, I had gotten a rejection from every school except for 2. And it was the end of the application cycle, and I knew that they needed to invite people for interviews, and people at that time had probably already accepted some other schools. So living in San Diego at the time, I drove to USC because that was one of the places I hadn't heard back from. And I knocked on the dean's door 30 minutes before the interview started, in my suit, with my resume, with my application in hand. And I said, good morning, I'm sorry to bother you before the interviews. I actually don't have an interview, but I wondered if, someone doesn't show up, if I could sit in for the interview. And he said, wait, where did you come from? And I said, I drove from San Diego this morning. And he said, I'm going to be honest, because of the accreditation process, we have strict rules. You can't be interviewed today, but if you meet me across the street at Starbucks, I'll sit with you for a few minutes before the interviews start. So I went across the street with him. He read my essay, he looked at my application, and he goes, gosh, I don't have feedback in terms of what you could have done better or differently to get an interview. It's just kind of luck. Unfortunately, you didn't get invited to an interview today. but I don't know what feedback to give you. Is there another school you haven't heard back from? And I said, the only other school I haven't heard back from is Stanford. Now, let me tell you something, first of all. These are 2 big schools. I also applied to a couple junior college PA programs at the time. I applied to a couple other, let's say, no-name college PA schools at the time. These just happened to be the last 2 schools I hadn't heard back from, which were long shots. They were dream schools, okay, for me. So I said, I haven't heard back from Stanford. And he was like, interesting. Okay. And he's like, well, keep your chin up. I really hope that you apply to us next year if you don't get in. And I think that you're, very qualified. It's just a matter of time, and the universe will decide when it's time for you to start PA program. I go back to San Diego. I go back to work, kind of down, thinking, gosh, I'm going to have to apply all over again. And like we were talking about, the prerequisites change every year. So some of the schools were adding other classes that you'd need to take to be able to apply. So 3 days later, I was at work as a medical assistant. I get a phone call, and it's from a Bay Area number. And I'm like, you know what? I don't know why. I'm going to take this call. So I go on break. I answer the phone, and they say, is this Alyssa Jackaloni? And I said, yes. And they said, what are you doing for the next 21 months of your life? I said, excuse me? And they're like, this is the Stanford PA program. We'd like you to come and interview for us. We think you're a great candidate. We'd like you to be a part of our program. I don't know, if the USC dean ended up calling Stanford or if that just happened to be the universe calling my name for time, but that's how I got into the Stanford PA program. From there, when you're in the PA program, programs are very different. Each one has a different set of prereqs like we talked about, and each one has a different duration of time. So they run anywhere from 16 months to 3 years. They cost anywhere from $45,000 for the whole time to $150,000 a year for the 3 years each year, depending on what program you go to. So there's a variety and a wide range of programs. At the time, Stanford's program was 21 months. It had a didactic or classroom portion, and then it had a residency portion that was throughout California. So I did my residency portion, and I knew I wanted to work with kids. Kids, teenagers, sports medicine, that was kind of what I always wanted to do. So I geared towards having an elective in orthopedics. I geared towards looking for electives in pediatrics. And the only elective in pediatrics in terms of hospital-based pediatrics I could find that was easy for me to have a rotation in was at Stanford. So they said, okay, you can be in the pediatric cardiovascular ICU, and you can go with the pediatric cardiothoracic surgery team. Cardiac was my worst subject in PA school. I could not figure out EKGs. I had the hardest time figuring out the physiology of the heart, how it worked. For whatever reason, that just wasn't the body part or the specialty that clicked to me. But I knew that on my boards, the heart is one of the most important body systems, and I wanted to pass my boards. And I wanted to work with kids, so I was like, okay, this is going to throw myself into the fire. I'm going to learn it eventually, and this is how I'm going to pass my boards. So I went in and I worked in the pediatric ICU, cardiovascular ICU for 3 months, and then I did a rotation with the cardiac surgery team. Interestingly, so when you're forming in your mom's belly as an embryo and turning into a fetus, your heart starts as a long tube, straight tube. As you develop into a fetus, the tube folds in half, and then the tube twists. And this is what creates the 4 chambers of the heart. And this is something that I learned once I got into the pediatric realm. At any point in that term of development, the tube can fold in half the opposite way. The tube can twist the opposite way. It cannot twist all the way and only twist part of the way. This is what causes what we call congenital heart defects, or defects that a baby is born with that they have developed when they were growing in the stomach or in the uterus of the mother. This was fascinating to me. So it was something that every baby's different. Every baby has a part where it stopped growing in a certain way or it folded in the wrong way. compared to adults where they all have normal hearts that folded the right way, twisted the right way, but they've been doing things throughout their life, smoking, drinking, eating high cholesterol diets, high sodium diets. There are genetic predispositions to having heart conditions, but a lot of times what you see in adult cardiac world are things that are preventable that people have done, right? In pediatrics, these kids are born this way. They didn't have a choice. And that I loved that. That inspired me. So I ended up getting offered a job when I was graduating PA school with the cardiac surgery team. And I now first assist in the operating room most days doing open heart surgery on anyone who has been born with a heart defect. So whether they're a premature baby that look like a little squirrel that can fit in your hand, or whether it's an adult who had open heart surgery as a kid and now they're coming back for a tune-up, we say, and one of their valves needs to get fixed, or they need a little additional surgery later in life. We also do heart and lung transplant on kids too. Working at Stanford has opened the door for huge opportunities of growth. It's a learning institution, so I teach at the PA program there. I've stayed in touch with them. They are constantly looking for innovative research, different ideas. So I work in the research lab and I operate on piglets to try and find different strategies that we can implement on the babies. And then a little separate, but I started a pet therapy program at the Children's Hospital. So if we rewind a little bit, personal life, my grandmother got sick before I got into PA school, and her dog needed a place to go. So we took her dog in, but I had a period of 4 months before I went to PA school and that I was home, and that happened to be the last 4 months of her life. So every day I'd visit her, and every day I'd bring her dog to the facility she was at to see her. And it became an event every day. The people who were staying in this facility would come to their doors, they'd want to see the dog. It brought a smile to everyone's face. My grandmother actually would only really communicate with us when her dog was around. It ended up being quite a form of medicine for her. And when I started at the Children's Hospital, these kids, this is the scariest days of their lives, scariest days of their parents' lives. Their life becomes the hospital. They go to school in the hospital. Their siblings visit them. Their friends visit them in the hospital. They're often there for a long time. So I was like, why don't we have pet therapy? I went to higher up people. I ended up writing a policy with infectious disease to allow dogs in the hospital. And I got Echo donated to me from a breeder who breeds for service here in Gilroy. And he went to be a service dog and ended up failing. We call it change of career, so I don't tell him that he failed. He just had a career change in life, and he's better at therapy than he is at service. So he comes to work with me, not in the operating room, but he sees patients in pre-op. So if I'm talking to parents about surgery and the scary things related to surgery, the kids are playing with him and distracted by him. Or if a kid's in the ICU and they're bedbound, but they're lonely, he comes and lays in bed with them. Or let's say they're on the floor getting ready to go home, but they're kind of, at this point, don't want to follow physical therapy. They don't want to get out of bed. They want to they're maybe a little depressed. We say, well, if you get out of bed today, Echo will come visit. Echo really needs a walk. So if you can take Echo for a walk, then that would be great. And we use him as incentives to get kids to get up out of bed. They can brush him, they can go for walks and those sort of things. So I've kind of evolved my role into being not only a PA in the operating room, but also using Echo as pet therapy for my patients. And I started off with a bachelor's, ended up getting a master's with my PA school online at the same time. And that was just an additional class that I took each semester. That didn't seem to add much, but it added letters behind my name that I, paid a couple extra money for. But now I'm going back for my doctorate in medical science with an emphasis in healthcare administration and executive leadership, because there is not a large pathway for PAs to go into leadership roles. and I'm trying to pave the way for that. So, yeah.
Question.
It's a lot, I know.
You do a lot. What's your work-life balance like?
So that was one of the biggest things for me when I became a PA, was figuring out what I could do for myself that made myself happy. Being a PA where I work, I'm very fortunate. PAs generally in this area start off making $100,000 a year. So you start off making pretty good money. I was able to pay off my PA school loans in 2 years. We have, at where I work, we get 36 days off paid vacation a year on top of sick time. So I travel a lot. I see my family in Southern California a lot. We do a lot of camping trips, and I long distance run with him. Longest he's run is 15 miles, so he's done a half marathon with me. And so, you know, it is a lot about life balance and figuring out what feeds your soul in terms of outside of work, and figuring out what to do for work that feeds your soul also. And if you can do anything, it's just to shadow as many different people and as many different specialties as you can until you feel something pull you that's interesting enough, and then all the work it takes to get there doesn't matter, because that's what you really want to do. Yeah.
What do PAs do in the surgery room?
Yeah, so PAs, it's a good question. I didn't really mention, but they can do so many different things within the world of healthcare. In the operating room, in California, PAs can actually operate in certain specialties without a surgeon in the room. So you can, for example, I train the training surgeon, so we'd say a fellow, how to open the chest, how to get things ready to go on the heart-lung machine or the bypass machine for the surgery. And then the surgeon comes in, the surgeon will do the procedure, then the surgeon leaves, and I train the fellow how to close the chest and how to get the patient prepared to go up into the ICU after surgery.
So you like close it?
Yeah, so I'm actually sometimes doing the cutting of the surgery, sometimes retracting or holding tissue away to make the exposure or the visualization of what the surgeon needs to do better. Sometimes I'm doing some of the sewing that's actually happening in the surgery. It's very hands-on. I have friends who are PAs in other surgical areas who, for example, if you tear your ACL, they're in one room getting the ACL prepped and ready to go into the patient, and then the surgeon comes in and they switch, and the surgeon puts the ACL in this patient, and she goes into the next room and gets the ACL ready for the next patient. So in surgery, they call it first assisting or second assisting, where you're assisting the surgeon in the surgery and getting the patient ready for the actual procedure of what you're going to do. You can also, as a PA or physician assistant, do so many things in terms of research. A big thing in this area is going into the tech industry, helping them make better products. So we just hired someone on our department who was working for Apple, and she helped create the EKG that's on the Apple Watch. So in terms of what you can do as a PA, there's so many different things.
Did you go to the biomed, what is it, in Silicon Valley? I think they have a...
Convention or something?
Yeah.
I didn't go, yeah, but I heard it was great. Yes?
I have a question. So, how would you become an
Nurse
ICU,
practitioner? Oh.
Yeah, technician, I guess? An ICU technician? Like, would you know?
Did you say NICU?
Yes.
Nurse practitioner, physician assistant, or just working in the ICU?
The NICU.
Oh, in the NICU.
Yeah, like with children, like with babies and infants.
Oh, yeah. So, as a PA or just as a nurse, or in what area?
Like as a nurse in general?
Mm-hmm. So when you're in nursing school, you can choose different specialties that you want to go into, and you have rotations that take you into those specialties. And then you can train to be a nurse that works in acute care or intermediate care, and that area lets you go into whether it be with pediatrics specifically, into the ICU or into a step-down unit within a hospital setting. Or you can work in an outpatient setting with pediatrics also. But to work in a NICU, we have a lot of students that come from nursing programs around the area that come and do rotations in our NICU. And then they often get hired from their rotations because it's in such high demand. That was another piece of advice that I got that I didn't mention, was that every person that you meet along the way, from school to side jobs you have to people you shadow, can think about it like an interview every time, because you never know where these people might know somebody, might be able to network you to, might be able to introduce you to, and you may reference back to them 10, 20 years later. And it's always great to have those relationships that you can call up, you know, in 10 years and say, hey, I know you work at this school. Is it possible for me to talk to you about this job posting that was at this school or at this hospital? And so just always keeping those doors open.
So what school are you attending for your doctorate degree?
Rocky Mountain University. It's an online program made by PAs for PAs out of Utah.
I've never heard of it, that's what
Yeah.
really they have one.
They actually take my master's credits. I have a master in medical sciences, and they applied that to the doctorate. So the doctorate's only 21 months long.
So you're going straight through?
Through the doctorate program?
Doctorate,
Yeah.
Other questions?
So it's kind of for all three. Any regrets?
I don't know if I'd say regrets. I mean, there's definitely mistakes that I made along the way, but I mean, a lot of that helped get me to where I am now. So, yeah.
And like you said, the universe, I'm kind of, you know, I kind of get mad sometimes, like, oh, why did I take so long? Why did it take me so long? You know, why did I move to Chico and do my LVN and then I partied too much? You know, but it's like, I mean, for me, I'm so social, like, I needed that, you know, I needed lots of friend time, and it's just, but yeah, and it's just, it's all in God's time, or all in the universe's time, if you don't put, you know, yeah, and then once I got into the program, and, you know, even my husband, and, you know, he's like, oh my gosh, can you imagine if you would have got in, like, when the girls were younger, like, this is, you know, because the RN program, you can't work through the program. And then my husband and I, we even talked about it years ago, like, how are we gonna, because I've always worked, he's always worked, we live here in Gilroy, that's expensive, you know. I'm like, gosh, well, what if can we even afford it, you know? And he's like, well, we'll cross that bridge when we get there. And, you know, a couple of years later, you know, we really tightened things up, and yeah, we made it work, and yeah, a lot of family help, but I mean, yeah, I guess it was meant for me to, you know, it happened when it did.
Yeah, I don't know if I'd say I have regrets. I think, like we said, the mistakes that I made really shaped the person I am, and I think that they were meant to happen to get me to where I am, so.
But it's hard because, like, when you're younger, and I think especially now, the generation now, like, you guys, like, the younger generation just wants instant, like, you want to be done with school, you want this, I mean, I see it in my kids, you know, if you want to know something, you look on your phone, hey, Google, you know, if we wanted to know something, oh, well, let's go look it up in the encyclopedia, because, I mean, a computer, we didn't have computers in high school, do we? Well, I think I'm older than the three of you, but.
They were coming out with computers.
Yeah,
when we were
I mean.
starting to graduate, so, but that's a whole nother.
I mean, it's like, yeah. It takes a lot of work. It takes time and it takes work to get where you want to be. It's not so instant. I'm trying to teach that to my girls now. Like, yeah, they want to start I want to make lots of money. Well, it's going to take time to make lots of money and hard work. Yeah.
Yeah.
Financially, financially, is there anything else you would have done differently to benefit you in the long run? Like with school, since you guys did so many programs, is there any advice that you would give to like help shorten that or to help with those programs?
So I took my master's in public health online, and a lot of the online programs are a little bit cheaper than the in-person. For public health, if you're looking at it, I mean, maybe unlike nursing, where you really kind of need to be there in person, learning how to do a lot of these different things. Public health, you can really learn online, I feel like. A lot of these programs are great now, especially for interactions with the professors and other students. So you don't always have to go to the top schools to get a great job. Yeah.
I think depending on the timing, the interest rates on your loans for school may be higher than what they were back when you first started thinking about it, or back when your parents were going to school. And so it's important. I was not taught, stuff about interest rates and about how to pay off my loans and those important things when it was my time to start looking at those things. And looking back, I think I maybe would have paid more attention to paying off higher interest rates sooner, and just, it never hurts to take out the loan as long as you are committed to having a job at the end that you're willing to put back into it, right? So if you're committed to doing that schooling, then it's something you're excited about, and then you're going to have a job at the end of the day, and being able to pay the student loans off right away, even if it's just a little bit each time. I would say I wouldn't hold off on it. I would just start paying it a little bit each time once you need to start paying it back, rather than letting the interest rate, take away a lot of the money and start paying a lot later.
And if you have an idea of where you want to go, a lot of employers, depending on the industry, will pay for you to go to school, so depending on what it is. I mean, even in government, my county is small, but we pay for certain classes or a certain amount. And I know at least a lot of the bigger counties or bigger businesses will pay for you to go to school while you continue to work for them, if you're able to do that.
Okay, well, we just have a few minutes, so I want to take the time to thank all of you for coming, and thank you for your questions. You're very thoughtful, and if there's something that you do think of that you didn't have an opportunity to ask, you can certainly email me or your instructor, and we'll try and get that answered for you. I want to say thank you to our panelists for taking the time out and coming to Gavilan and speaking with our students. We really appreciate it, and I hope that we could do this again, maybe. I think it's very valuable to all of you. And again, I want to thank Darlene and Jessica, and this is one thing I'll take this second to plug. If you have not met with an advisor in the health and wellness career and academic pathway, which most of you or all of you are in, Darlene and Jessica are your CAP counselors, your CAP advisors. So if you have questions on your path, or maybe you're thinking about something different or changing a path, that's okay. They're here to help you with that. So if you haven't seen a counselor yet, make sure you talk to them and check in. So I want to thank both of you for helping organize, and Jamie for helping organize, Grant and your team for filming, and Rosie's team for taking photos. We will post this for our students that were not able to be here, although if you're here, if your instructor is giving extra credit or something, you better check in with your instructor for that. But this will be posted for other students to see and get the benefit of the information that you all have shared with us. So again, thank you. I think we can do another round of applause. And if you're hungry, you probably smell the pizza. There's pizza out in the hallway. Thank you again. Yeah.